Hi, and thank you for coming to our presentation. The title of our presentation is Network Analyses on Hyperlinked Online Resources for Dissemination of Clinical Evidence, Updates of COVID-19 Vaccine Information over Time, and Measuring the Freshness of Information. My name is Meredith Abrams, and Dr. Dongwen Wang is also a contributor on this project. Since its outbreak in late 2019, the coronavirus disease, or COVID-19, has quickly developed as a global pandemic. As of September 2021, there are over 219 million cases and 4.5 million deaths worldwide, and over 41 million cases and 660,000 deaths in the United States. Rapid dissemination of COVID-19 clinical evidence to healthcare providers, patients, and the general public is a critical step to mitigating disease and ultimately addressing this challenge. An important recent development in COVID-19 research is the approval of the use of the COVID-19 vaccine. Several vaccines have been developed and released over the last year, including the Pfizer vaccine and the Moderna vaccine, which followed soon thereafter. These vaccines have become important tools in the mitigation of the spread of disease. As such, many new guidelines and regulations describing the appropriate use and administration of the vaccine have been produced, posted online, and disseminated to clinicians and the general public. These guidelines are often updated frequently to include the newest clinical evidence and clinical considerations. As these guidelines and recommendations are posted online, they often link to each other, leading to a larger network of related resources. Analyzing these kinds of networks of information has become a very hot topic in recent years. A popular method for analysis of these linkages is network analysis. Network analysis can help in identifying the underlying network relationships in a collaboration that people rely on to find information and solve problems. Network analysis also can be utilized as a tool for visualizing the structure of collaborations, informational flows, and key roles in organizational structures. Here is a simplified version of a network. We have nodes, in this case, web pages, that contain information about COVID-19 treatment, vaccine injections, and possible adverse reactions. The linkages or hyperlinks between these web pages are considered edges. They can count the number of times a single document links to another document in the form of a hyperlink to determine the weight of those edges. We can use these combinations of linkages and nodes to calculate standard structure measures, such as the degree of connectivity. The degree of connectivity identifies the number of inward linkages, outward linkages, and the combined total of linkages. From these standard structure measures, we can gain a lot of information about the interconnectedness and importance of resources within the network. However, that information is liable to change over time, and traditional network metrics do not consider the temporal aspect of the information contained within the node. The COVID-19 guidelines and other informational resources have been updating very frequently, given the rapidly changing nature of the broader understanding of and treatment of COVID-19. Therefore, it is important to measure how recently this information has been updated. In measuring the information freshness, it enables the identification of important evidence in the latest research. By identifying timestamp information from each resource within the network, we can apply a measure for freshness to each node within the network. In doing so, with a measure such as degree of connectivity, we can generate an integrated measure of freshness and importance. We can incorporate these measures into the network analysis to account for both importance and freshness of the information. This work is part of an ongoing research project to develop a systematic framework to leverage network analysis for identification, organization, semantic processing, visualization, structural analysis, dynamics examination, and usage pattern assessment of online resources to improve dissemination of clinical evidence. This preliminary study is focused on online resources related to COVID-19 vaccines. In this study, we aim to utilize the timestamp data collected from online resources at different time points to measure the freshness of information and to assess the depreciation of that freshness. The initial scope for our data collection is part of a broader project to collect resources from all aspects of COVID-19. For this project, we subset the dataset collected to focus on the subtopic of COVID-19 vaccine. To collect our network data, we utilized a web crawler to automatically collect hyperlinked online resources related to COVID-19. We started the web crawling sessions from the coronavirus homepages of the Centers for Disease Control and Prevention and the World Health Organization. To ensure that the web crawler would only retrieve relevant resources, we developed a set of 242 keywords related to COVID-19 clinical research and patient care. For this purpose, we reviewed the medical subject headings and online glossaries for COVID-19 resources. Certain general terms were included, such as virus and infection, as they often pertain to COVID-19. However, in order to focus on resources related to COVID-19 vaccine, our subnetwork contains only resources containing one of the specified keywords listed here. This process led to an induced subnetwork of COVID-19 vaccine, which is the focus of this study. We collected data at 3 separate time points. We started the web crawler in February, again in March, and for the 3rd time in April of 2021. Each of these data collections were approximately 3 to 4 weeks apart. Using open source R packages, we were able to identify the timestamp data from each URL we collected data from. We reviewed the timestamps and determined the lifetimes of a specific resource as the length between 2 consecutive last updated dates. For this analysis, we excluded all resources that did not contain a specified last updated date. For a specific online resource, we can define its freshness factor as 1 when that resource has just been updated. Likewise, when a resource is completely out of date, the freshness factor will fall to 0 just before it's updated. We calculate the freshness depreciation rate of a resource as 1 over the lifetime of that resource. Here, FDR is between 0 and 1. When FDR is 0, it indicates the information freshness for that node or resource will never decay. However, when the FDR is close to 1, it indicates the information freshness in that node becomes outdated almost immediately. Given how rapidly the resources within domain topics related to COVID-19 are changing, we expect to see a high freshness depreciation rate due to expected lower lifetime values. For example, as resources are changing quickly, the lifetime values in days will likely be very small, leading to a higher FDR. This study is only focused on the FDR for COVID-19 vaccine. For our results, we recorded 1,925 unique resources combined from the subnetworks of February, March, and April data. Among them, we identified 725 resources with parsable dates and narrowed it further to 343 resources that persisted in all 3 subnetworks generated. We obtained 235 total resources directly related to COVID-19 vaccine, but excluded 33 with unreadable or otherwise unidentifiable dates, leaving us with 202 total resources related to COVID-19 vaccine with exact last updated dates. Among them, 144 had an update between February and March, 145 had an update between March and April, and 57 resources did not change at all between February and April. We computed a total of 322 lifetimes for the 202 resources. 120 of those resources updated twice. The range of the lifetimes for COVID-19 vaccine resources was 4 to 439 days and had an average of 68.24 days. Among the resources, 25% were updated within 19.5 days, 50% within 43 days, and 75% within 59 days. We calculated the daily FDR for each lifetime and found a range of 0.0023 to 0.0025 with an average of 0.057. Among them, 181 of the daily FDR values, over 50% of them, fell within the range of 0 to 0.024. This exploratory study examined the lifetimes of resources for COVID-19 vaccine. We found that on average, resources in this domain were updated within 68 days, but could be as soon as 4 days. It is important to note that the lifetime of resources are related to how fast the clinical evidence is updated within that domain. The average FDR for a category of information will allow us to contrast the differences in update speed for clinical evidence on specific topics. We might expect to see a lower FDR indicating slower freshness depreciation in a more stable clinical domain such as TB, where resources are less frequently updated, and we can expect to see a higher FDR for a new or quickly changing domain topics such as COVID-19. Further study is required for different clinical topics. Once the average FDR for any domain is determined, we should be able to use it to estimate the freshness factor for a specific resource at any given time point. We can then incorporate the freshness factor of each node into the broader network analysis such that we can generate an integrated measure for structure and freshness. This integration will apply the temporal consideration to each node within the network and subnetworks. The limitations for this study stem from a few primary areas. To begin with, we focus solely on the COVID-19 vaccine as a subtopic. This research will need to be expanded to other domains and domain subtopics to assess the generalizability of this method. Secondly, we only utilized resources wherein we had a known starting and ending date. This led to a fair amount of resources being excluded that potentially contained very useful information. Third, in our data collection process, we started the web crawling from only the WHO and the CDC. In doing so, we may have inadvertently limited the resources identified. However, given the depth of the crawling utilized in this study, the web crawling sessions typically generated over 10 million resources and therefore may have identified sufficiently relevant resources. In conclusion, our preliminary results have shown that it is feasible to capture the timestamp of update for online resources and then compute their lifetimes. From this, we can then derive the freshness depreciation rate. Further research is necessary to compare the FDRs for different domains and subtopics and to incorporate these measures into network analysis, such as to account for both the importance and the freshness of each resource. In this presentation, we have included some of our references. And now I would like to take a moment to say thank you for joining us for this presentation. If you have any questions or would like any more information, please feel free to contact myself, Meredith Abrams, or Dr. Dong Winwing, who is also listed on this slide. Thank you.